We will now discuss the detail of analytical studies, which includes the observational and the experimental study plans. First of all, the case control study design, which is an observational study. I previously discussed that in this design, we take the disease cases and we interview them. We ask them if they were exposed to a risk factor or not. And then we compare their findings with a control group, that is, a group of healthy people. So, here, starting with the population, categorizing them as whether they are diseased or non-diseased, asking the diseased ones, that is the cases, if they were exposed to a risk factor or if they were not exposed. At the same time, we are asking the healthy group, the control group, if they were exposed to the risk factor or not exposed. We then compare their exposure rates, and then this comparison tells us which group was more exposed to the risk factor. If the cases had the higher levels of exposure, then we can prove that the risk factor is causing the disease. So here we are proving a hypothesis of a disease risk factor. Now here you have seen that we started with the cases and we ended with their exposure history. So we can say that we proceeded from effect to the cause. The cause is the exposure and the effect is the disease. And we have traced back our population to recall their exposure levels. In the next study design, cohort study, we start with the cause and we end with the effect. That is, now we are taking people who are exposed to a risk factor and those who are not exposed to the risk factor. We observe both these groups. We follow them in future and observe if they develop the disease or not. Then we compare the disease rates among the exposed ones and those who are not exposed. This comparison tells us whether the disease was more frequently occurring in the exposed people or in the non-exposed people. So here we proceed from the cause, which is the exposure, to the effect, which is the disease outcome. Here temporality is written. What does that mean? It means that as the population is under our observation, we can prove that exposure leads to the disease and not the disease leading to the exposure. For example, I am interested in finding the relation between smoking, which is the exposure, a risk factor, and lung cancer, which is the disease. So in cohort study, I will take the smokers and the non-smokers. I will observe them both in say 6 to 10 years, and then I will observe how many of the smokers develop the lung cancer. I will compare the rates in both groups, and this will prove that smoking led to lung cancer. This is an advantage of cohort study that has the element of temporality, that is the relation between exposure and outcome is well defined in time. However, this feature is not available in case control studies, where you simply ask the lung cancer patients, did you smoke or not smoke? and you ask healthy persons, did you smoke or not smoke? If we observe that the lung cancer patients reported more smoking, we cannot confirm that smoking caused the lung cancer. It may be the other way around. It may be that lung cancer caused higher smoking rates, maybe due to some depression or some other reasons. So it's hard to establish if there is true temporality in case control studies. Which comes first? We cannot confirm. Um, we cannot say that the exposure preceded the outcome or whether the outcome preceded the exposure. This advantage is only available in cohort studies. That's why we say that cohort studies are more authentic than the case control studies. Next, I will discuss an example and study it using three different study designs. I want to uh, assess the relationship between serum cholesterol level and hypertension, high blood pressure. So, in a cross sectional survey, I will ask questions from people like this: are you having high blood pressure? Or maybe, were you diagnosed with high blood pressure? What is your recent serum cholesterol level? Remember, cross-sectional survey is a prevalence study. It simply measures the frequency of a disease, a risk factor, and we do not tend to prove a hypothesis of a relationship between these two variables. However, in some cases, people find relationship between variables using these surveys, and then they label it as analytical cross-sectional studies. That is also fine. But you will not make a hypothesis. You will not start with hypothesis writing in cross-sectional surveys. And the authenticity of this evidence of of relationship will not be as much as that of analytical studies. Now, if I find that those persons who are having high cholesterol levels are also reporting high blood pressure, then it can give me a clue for making a hypothesis. And if I have got a hypothesis, I will choose one of these analytical study designs, either case control or a cohort study. So here I start with my hypothesis. For case control study, it will be the hypothesis of proving that serum cholesterol level was higher in hypertensive as compared to control group. So I will take patients with hypertension and I will take a control group without hypertension. I will ask both these groups, what was your serum cholesterol level 2 years back? Right? Same question from both groups. And then I will compare the serum cholesterol level in both the groups. If I find that this group with hypertension reported higher serum cholesterol level, I can prove my hypothesis, but to further prove it with higher authenticity, I will conduct a cohort study. So, a cohort study will again start with a hypothesis. It will be that the risk of hypertension is higher in individuals with high serum cholesterol levels, and some cutoff I will decide. Then I will take a population, that is, the population is called cohort. A cohort is a group of people with same characteristics. So I will assess who in this population, who in this cohort has high cholesterol and who has normal. So I will make two groups. I will enroll them in my study. I will observe them, do their follow-ups, keep a record of their blood pressures in next few years, and then I will compare their blood pressure levels, and this will give me proof of whether my hypothesis is true regarding the hypertension being related with high serum cholesterol levels or not. So this is how you conduct cohort study and case control. And next is the comparison of cross-sectional survey. Because I compared it with the analytical study designs, I will now want to compare with ecological studies because they both are similar in one aspect. Here we take individuals and we ask them for their exposures and their outcomes, and here we take groups, that is populations. We have already got the statistics regarding their exposures and their disease outcomes. In both these cases, we assess and we measure the outcome and the disease at the same time. The difference is that cross-section survey is at the level of individual and ecological studies are at the level of groups. That is, countries' data is retrieved. We already have their statistics. We just relate them using our um, statistical calculations. And ecological studies also simply give a clue for hypothesis. Next is the experimental study design. This is the last one to discuss. It's similar to cohort study. Here we start with a population, just like a cohort study, and we proceed to some exposure, and then we proceed to measurement of outcomes. But the difference is that in cohort study, the exposure was naturally available to the population, whereas in experimental design, we expose the population ourselves. That is, the researcher intervenes here, the researcher decides and gives exposure to one group and not to the other group. Now the exposure is not actually a risk factor, but it is some intervention, some experiment. For example, exposure to a new drug that the researcher thinks can be more beneficial to the patients. And he studies its effect in one group, and to the other group, the researcher can give some other treatment, that is conventional treatment, or maybe a placebo, or maybe no treatment. Then the researcher compares their outcomes and proves the hypothesis of a drug success. Now there are different types of experimental studies. They can be randomized. Randomization is a procedure of random allocation of study participants to two groups, one group being given the new drug and the other the placebo. And if this allocation is random, for example, it's done by balloting, and the researcher does not decide who is to be given what treatment and decides by balloting, then it is called the randomized trial. If this allocation is non-random, it is a non-randomized study. If it is lacking the randomization or a comparison group, it is quasi-experiment. Then it may be a natural experiment. For example, the case of PIC incident where atorvastatin drug was mixed with pyrimethamine taken by heart patients. Lastly is the before and after studies such as the effect of seatbelt use.